Hi, I'm Lisa Saunders. Welcome to my show. I'm really excited today because I'm going to talk about a problem that many of us have, especially as we get older. And I have Dr. Joanne Moore here, a physical therapist, to help us learn how to treat this condition. We're going to talk about arthritis.
We are going to talk about arthritis today.
Okay, thank you. Now, what are symptoms, like what is arthritis and what are symptoms of it where you might start suspecting maybe I have arthritis?
Right. Arthritis is basically a wear and tear of the joints. And it leads to stiffness and pain in almost any joint.
When you say wear and tear, so is that why I hear people talking about, my arthritis is really killing me where I had a football injury? So it's not just normal joints, right? It's if you've actually had an injury, you can start feeling arthritis years later?
Injuries predispose us to getting arthritis younger than we should have had it.
Okay.
Every joint is coated with some cartilage. Maybe we could take a look at a slide. It's
okay,
slide,
so we can kind of picture.
Slide number 2 shows us the cartilage that's in a joint that is a barrier. Now let's go to the next one. Nope, one more. There, that'll work. There we go. We're normal. We're still young. We're normal. There's a little bit of articular cartilage that you can see there. It's the blue line at the end of the joint. And okay, we can go back to us now. Thank you. That cartilage is always wearing down and building up over the course of our lifetime. Just like our skin sloughs off and rebuilds continuously, so does the cartilage. And what we want is a balanced equation between the cartilage breaking down and the cartilage building up, so that it always stays the same level of thickness. And that layer of cartilage keeps us from being bone on bone. That cartilage is nourished by synovial fluid because there's no blood supply in the joint. As we start to get older or we start to have injuries, it thins out a little bit faster than we can build it up.
Oh, okay.
And then we start losing that race. And once there's a little breakthrough of that cartilage, then a bone spur can grow up.
Oh, gosh.
And it's that spur that's so painful.
All right.
And that's the start of osteoarthritis.
Oh, that's the official name for it?
That's the official name for it.
And we just all shorten it to arthritis? So
Correct.
We can say it? Okay.
There are about 300 different kinds of arthritis.
Oh.
But most of us just develop osteoarthritis. And that's a normal wear and tear type of thing. And now if we could go back to that second slide that shows the body, it shows us all the sites where this is commonly happening. So the red joints are the ones that are affected typically. It's the neck and the low back, the hands, the hips, the knees, and the great toe. And that's...
so when you say great toe, do you mean the big toe?
The big toe.
Right, the joint of the toe?
The joint, and sometimes it looks like a bunion, where it starts veering off in the wrong direction.
Okay.
So those are the joints that are typically involved in osteoarthritis. And sometimes it's the shoulder as well.
Okay, you don't have little red things on the shoulder, but
correct
in that case. But
okay,
these are
that's great. Thank you.
So this is why my hands are starting to feel a little funny.
Exactly. That cartilage should be oiled and slick, like an ice skating rink. It should just be a frictionless gliding.
Okay.
And when it starts to thin or become inflamed, then you don't get that frictionless movement anymore.
Okay, so all right, so if you're starting to feel aches in those areas that you mentioned, that's when we might think that we might have arthritis.
Well, in the beginning, you're having only inflammation. And if we could take a look at the fourth slide, maybe the third slide, it shows inflammation is a reversible condition. So if you're just starting to get some joint discomfort, perfect. Now is the time for intervention. Thank you very much. With the inflammation, there's been no damage to the tissues yet. So you can reverse the inflammation.
And is this the time to run to a physical therapist?
A physical therapist or your pharmacist, because there are great medications for this as well. They are disease-modifying drugs. They completely reverse the process.
Oh, really?
So now is the time to take something like glucosamine with chondroitin, because we talked about that equation, and you want to build up at the same rate that you're breaking down. And there's nothing that can help you build up faster, but the glucosamine with chondroitin can help you break down more slowly so that your ability to keep up is improved.
Because I always thought people made that up, that they were, watching these shows and taking all these vitamins and everything. So this is a real thing.
Okay, the reason that there's some controversy about that is because some people wait too long to take it. So if you still have some cartilage there, you have something to protect and to work with.
Okay.
If you wait until there's no cartilage left, then there's nothing to protect.
So this is something I always never tell doctors hardly any of my problems because I'm afraid they're going to stick me on medicine or something.
Oh.
But this is one of those that I should mention.
I like that, and it's not a medicine really. It's a kind of a food supplement.
Okay.
And so you just buy it in the store over the counter.
All right.
It's not considered a medication.
And so you don't think there's big side effects to that, or you probably
I
should
have
tell
not
your
heard.
pharmacist.
I have not heard of any side effects, but it's always a good idea to talk over with your pharmacist anything that you want to take.
Right, even herbal medication, I know you should.
They're real.
Right, they are real. They
And
really do something to you.
If they have an effect, then you need to consider how it's going to interact with other drugs that you might be taking.
Now tell me about your practice. Do you treat a lot of people at your practice for arthritis?
Yes, we see a lot of people with arthritis. Most of my doctoral work was done in the study of arthritis.
Okay.
And we see people who have rotator cuff injuries because the bone spur has hooked onto the rotator cuff and there's been wear and tear and erosion, and eventually it ruptures the rotator cuff, so they have to get it sewn back up by the surgeon.
Oh, wow.
We see people who need total knee replacements, total hip replacements. But we can also do a lot of prevention.
Okay, what could I do if I came to your practice? Now that's in East Lyme, correct? Okay, what can I do to prevent?
Okay. We encourage people to have their joints properly aligned. If you think about the tires on your car, and if they're a little out of alignment, how it wears out on one side.
Yes.
Well, if someone is flat-footed and they're turning in this way, their knees are going to kind of knock together a little bit. They're bearing more weight on the inside of the knee than on the outside of the knee. And so the inside of the knee, the front middle side, is going to wear out faster. You're going to develop arthritis on the inside of the knee because you're putting all your weight there.
Okay.
Where if someone has very high arches, they may bear more weight on the outside of their knee. So I really like to put a little bit of a lift in their shoe, a little bit of an orthotic to correct the foot.
Okay.
It puts the knee in good alignment and allows that cartilage to heal early on. And especially if that person is a runner or an athlete of some sort, or they're on their feet at work all day. If we can just correct the alignment, that's going to help prevent a lot of the weight bearing on the wrong side of the joint and equalize it.
Okay, so you just kind of look at their feet to see what they need as far as an arthro.
And that'll go all the way up to the hip and the low back. If
Okay.
they're bearing weight properly, I had a professor who used to say everything changes when the foot hits the ground. And you need to have that good alignment from the bottom, and it'll translate all the way up the kinetic chain and reduce the wear and tear. And then you want to have good shoes with good shock absorption, because every time the heel hits the ground, the shock comes up through the knees, the hips, the back, and adds to the wear and tear. So good shock absorption in the shoes.
Now, how do I know if it's good?
Well, it'll be a little rubbery on the
just
bottom.
Feeling like a little,
cushion.
You're just a little happy when you get in them. You feel, I have some cushion.
Exactly.
So if you're feeling happy, that's a good sign so far that it might be a good shoe. Okay.
It is. And shoes are a whole nother show.
Oh, okay.
How to select the right pair of shoes for your body.
Would you come back?
I would love to.
Because it's such an important, when you're a teenager, you want these cheap shoes and a million pairs of them. And I look at some older people's feet and they tell me I wore high heels and they look so deformed, like the toe is completely crossed over. So I want to start wearing, I want to make sure, now I'm wearing more realistic shoes, but I just want to make sure.
You've got 50 pair of shoes in your closet and you only wear 4.
Yes.
And it's because those 4 are the right ones for you.
Right. And
so look at those and keep buying stuff like that.
Right.
But I can tell you why. Yeah, that's a lot of fun.
All right. All right. What else should I do and other people do before it's too late? Or tell us what to do when it's too late. You know what I mean? When you've really done the damage.
Well, also keeping weight down really helps a lot. Having good posture helps a lot. Not smoking helps a lot. Because the cartilage has very poor circulation, and when someone smokes a cigarette, all the circulation stops. It constricts all the blood vessels, and damage is allowed to happen without any healing, because we heal with good circulation.
Okay.
So smoking is a strong risk factor for arthritis. And then avoiding crazy injuries.
And then the whole point is always, if you're going to start some new exercise program, talk to your doctor.
Right.
So you don't injure yourself.
Right. And if it's too late, if you've already got the arthritis, there's still an awful lot that you can do to be comfortable in your life. There's all sorts of ways to modify your activities. When you go into stores now, you see tools with bigger handles so that you don't have to squeeze so tightly. And that's true for kitchen tools and for workshop tools.
Oh, really?
There's also anti-vibration devices to put on tools so that the vibration doesn't come up and bother us.
See, my husband's been having a lot of trouble because he's been trimming more. And
even bike riders.
So it's the vibrations.
Vibration's very traumatic to a joint.
I didn't know there was something you could, wow, you have a lot of really good tips.
So that, and then we tape a lot, we splint a lot to allow a joint to rest, because resting is as important as exercise.
Now, I'm just curious, how do people come? Do they get, doctors have to prescribe it, correct, if you want insurance to cover it?
By state law, you do not need a doctor's order to come to physical therapy anymore. That used to be true.
Okay.
However, most insurances require that a doctor has ordered it in order to get it covered by insurance.
So if you are feeling those aches and pains and you're starting to suspect, see a doctor.
Correct.
Because they may not prescribe anything horrible. They may just tell you to take that over-the-counter
glucosamine with chondroitin,
and to see a physical therapist.
And also anti-inflammatory drugs are very helpful. And as something as basic as aspirin, it disables an inflammatory cell for the rest of its life. So aspirin is great, but it bothers people's stomachs.
Okay,
it can cause
you probably
some internal
have to watch
bleeding.
out how long you're on it, right?
You can't take too much of it. But there are safer drugs too. That are prescription.
Now, how there are several physical therapy practices. How does somebody know a good one to choose?
Well, probably most physical therapists are good, but some of us specialize in something more than we specialize in something else.
Okay.
So when you look at the letters after someone's name, and there's so many letters now to choose from.
Right.
PT means that they have their license.
They have a physical therapist.
They have a physical therapy license.
Okay.
Most of us now have doctorates. So it's a DPT, or mine is a Doctor of Health Science. But when you see a D, that just means that they've had 7 years of training versus the 4. Then we can specialize. After we have practiced for 5 years, we can take another exam. And I took the orthopedic exam. So after my name, you see OCS, which means that I'm a board-certified orthopedic specialist. But other people's might have a G, geriatric, or an N for neurological, or P for pediatric.
So those initials, the general public has no clue what they are, but doctors will look at your name and those initials and say, okay, this is the person I recommend for my patient.
Because they specialize in that.
Okay.
Right. So lots of us are great, but we may not specialize in that particular problem.
Now you have several people in your practice.
We have 7 therapists, and 2 work only with pediatrics, and 1 is a certified hand therapist, and the rest of us are orthopedic and neurological. So we work with MS or Parkinson's or
My daughter
those
had
types
cerebral
of
palsy,
diseases.
and she had a lot of physical therapy.
Exactly.
And occupational therapy.
We love the kids. We do love the kids.
Do you have exercises you could show me? Because I saw that you had some hand exercises, and I really could use them myself.
Yes. Now, exercises are important because when we exercise gently, the synovial membrane around the joint starts to produce more oil. Mm-hmm. And then as you gently move, the oil is spread over the surface of the cartilage. So if we have a little rough spot, it just feels better because it's oiled. So that's why when we first wake up in the morning with arthritis, there's that stiffness, the soreness, and then after some time has gone by, generally less than an hour, it's all lubricated and it feels much better, and you can actually go about your day fairly well.
Right.
But maybe after you've sat for an hour, you feel the stiffness again when you first get up. You'll feel it in the knees. Like after a movie, you kind of have to stand for a few minutes.
And drive,
and
car
do
rides
that.
can be terrible.
Exactly. So the reason for that is because when we're sedentary, the synovial membrane stops producing the oil and it dries out. And that's when we're most at risk of an injury, of tearing more cartilage. Because if you have this knee joint that's dry and you start standing and pivoting on that knee, you're grinding it more and you're damaging the cartilage more. Mm-hmm. So we don't want to do vigorous exercise first thing in the morning. Mm-hmm. We want to warm up first and then do it. So for the hands, which are very commonly involved, there are 3 exercises. So you start with your hands straight, and the first one is a hook. So it's like this, keeping this part of the hand very flat.
Am I doing it correctly?
You are doing it very nicely, Lisa.
Nice free therapy.
Yes.
How many times should I be doing this?
We do about 10.
Okay.
And by doing these exercises, you're strengthening the very small muscles in your hand and preventing deformity from happening during the inflammatory stage.
Oh, because you see these hands, that you can tell they have arthritis.
Right. The second exercise is a hinge. So you're keeping the fingers very flat.
See, yours are better at staying flatter than mine are. Is that because
I practice.
Okay, 'cause I'm thinking, wow.
It's not easy.
I must need to do this.
There you go. That's intervention, early intervention. Then the third one is an open fist, where you're trying to touch your wrist with your fingertips.
Ooh, so that's hard. That's work, because
So
obviously
you're a
you
little
can't touch your wrist, but
correct. But you should be able to touch the hand.
and you get down way much further than I do. Oh my gosh, I have a lot of work to do.
But look what you can do. And it prevents deformities by strengthening the little muscles that are on either side of the joint that act like the reins on a horse. And if one of them gets stronger than the other, it deforms the joint by pulling on it.
So that was a good exercise.
It's nice, isn't it?
So you do that every morning, or what do you recommend?
I like doing exercises after you've warmed up. So maybe after breakfast or sometime during the day.
Okay. So that's just,
Yeah.
and that's a good thing for desk sitters.
It really is.
Because as a writer, unfortunately, I'm sitting a lot. So actually, I'd love for you to come back and talk about other exercises.
You're a hanthelete.
that I could do in my chair. Now, I'm sure you believe, like everybody else, you should get up once an hour, right?
Of course.
Yeah. But when
Well,
you're
it's good to
sitting
just roll your shoulders back too, because this will help protect your rotator cuff.
Okay.
When the shoulder blade is allowed to come up too high, that's when it impinges.
Okay.
And can erode the rotator cuff. So if you do nothing else,
So this is just a good thing to do when you're sitting at your desk.
Exactly.
Because there's times that I'm just staring at the screen thinking.
Yeah.
So that could
It's a
be
good habit.
what I do when I'm thinking.
Yeah, that's a good
Now,
habit.
how do you keep sitting up straight?
The other thing is the chin tuck, pulling the head back.
Wait, you have to do that at your desk too? What does that do?
It gaps open the space for your spinal cord.
Okay.
Gives you more room for your spinal cord. It prevents headaches too, eye strain.
Oh.
Sometimes we tend to look forward all day.
Right, and I'm looking forward like this.
And if we do that over decades, and many women do, To show that we're listening to someone, we put our head forward. In our culture, that means I care about you.
Right.
But then by the time we're 60, or 70, our backs are all rounded.
From listening to everybody's problems.
Exactly. Exactly. So
I wonder if mental, emotional therapists have those problems.
Yes, they do.
They do.
Of course they do. And first grade teachers, they're always, oh, honey. You can tell who they are.
Oh, that's so funny.
Yeah. But you want your furniture to support you. You can't sit up by yourself all day.
Right. Like I hate going to restaurants and I have to sit on a stool.
Right.
It drives me crazy.
You need your furniture to fit you well and support you.
Right. Mm-hmm. All right. But so I have to remember to sit up straight though, because that is like an act. Even if you have good back support, you still need to do the act of sitting up.
That's right. But the thing is, my point is that you can live well just by modifying what you want to do.
Right.
Very rarely do I tell a patient you can't do that. Mm-hmm. I'm saying let's figure out how you can do that. Mm-hmm. And the patient's goal is my goal.
Right.
And we work closely with your physician, with your nutritionist, with your pharmacist to try to get you as functional and as comfortable as possible throughout a really long lifespan.
Right. Like I saw a physical therapist for my back because I was just, I was getting like sprinkly feelings at my back. I thought I had some terrible disease, but she said no. I forget what she called it, but it's from writing like this all day. And so now I do a lot of exercises, just trying to get my shoulder blades.
That's it. It's all about the shoulder blades.
Now, we have a few more minutes, and you had a very interesting topic. Do you want to cover it, or should we cover it another time?
Well, this is a great segue into, we tend to get arthritis at about 60, maybe. Mm-hmm. And a lot of us also at that same age start to develop some urinary incontinence, which is a little bit of leakage of urine.
Which nobody wants to talk about.
No one wants to talk about
Nobody wants to go and buy those diapers at the...
But look at how much space the stores dedicate to diapers.
Yes.
This is big business. A lot of people must be buying them or they wouldn't fill up a whole aisle with them.
Right, and even there's some commercials, we'll discreetly deliver them to your door.
And that's even more that we're not seeing in the stores.
Right.
So my hypothesis is that arthritis of the hip causes some muscle spasm between the two hips. And the fascia, the connective tissue between the two hips, gets pulled by the muscle spasm. Mm-hmm. And just like a water balloon, when you pull on that urethra, it squirts. And I think that the hip osteoarthritis has something to do with the timing of us getting the urinary incontinence at the same time. So treating the hip arthritis often takes care of the urinary incontinence.
Oh, really?
So somebody who's getting both some hip discomfort and the urinary incontinence at the same time, let's take a look at that hip in physical therapy and see if we can intervene and save you some money on those diapers.
Yeah.
Right. There are basically two kinds of incontinence, though. Urge and stress. Urge is that feeling that you gotta go right now, even though you just went 10 minutes ago. And then you run to the bathroom and there's 3 drops. It's a misperception that you have to go. You don't have to go.
Unless it's a urinary tract infection.
Exactly.
Okay, but
and that'll burn too. But,
right.
Or if you hear the water turn on and you've got to go, that's not a real need to go to the bathroom. That's a hyperactive nerve.
Okay.
And that can be trained like any other habit. So empty your bladder, turn on the water, you know you don't have to go. Now go for a walk. Mm-hmm. And just distract yourself. Or get involved in a hobby. Distract yourself. You do not have to go. And just break the habit. Like some people, as soon as they pull the car in and they turn the key in their house, they've got to run to the bathroom. That's a habit. It's not real. Park your car, go check the weeds in the garden, go walk around a little bit, and then come in.
Now, so were our mothers wrong to tell us to go to the bathroom before we took a car trip?
Yes. That's a call just in case. Although I won't blame mothers for anything. If that helps to get them where they need to go, that's okay. But it does upset your neurological system. It does start to train you to go when you don't have to go. And that starts to confuse you.
Very interesting.
So that we can break with behavioral strategies. And if you can't do it yourself using those distraction techniques, then we use electrical stimulation. We put 2 patches on the back and 2 on the inner thigh. Or sometimes, if the person's willing, we use an internal electrode because that's actually more effective.
Really?
It's more effective, and it gets rid of it.
Wow.
It gets rid of it.
This is something you can do in your office?
We do it in my office, and I'll see a patient once a week for 6 weeks. It's a 20-minute session, and they're cured. For the most part.
Amazing.
It is amazing. You do not have to live with that. Now, stress incontinence is the other. That's called urge. This is stress, and that's not emotional stress. It means you're putting a stress on the bladder and it leaks. So that could come from laughing, jumping, sneezing, that kind of thing. And it's just weakness of the pelvic floor muscles. And so we treat that with Kegel exercises for the most part, which is a tightening as if you're going to try to stop the flow of urine and hold it. It's not that easy though, because you have to hold it for a full 10 seconds. 10 seconds is a long time on the clock to hold that Kegel.
How many times are you supposed to do that?
30.
30 times?
Not all at once necessarily. You can do three sets of 10 throughout the day, or you can do 2 sets of 15.
All right.
But
now we only have 2 minutes left, so what do you want to tell me so that I don't have to buy, is there anything you want to tell me so I don't have to buy Depends or anything else?
Well, since you bring that up, I love chemistry, and I'm going to show you, if you haven't solved the problem yet, there is a way. If you have to buy pads, make sure you buy the right ones.
Okay.
All right. Now this is a coat for menstrual blood. And you can see that when I pour this, can you hold that for me just kind of flat? Okay. When I pour the water on, see how it just runs off?
Right.
These don't work. And you're just going to get frustrated because it's going to leak everywhere.
Okay.
This one is intended
for urine?
for urine.
Okay, so you really can't just use...
And you see how I can pour
Yeah, so there is a difference.
a whole cup of water onto this.
Wow.
And it does not leak. So you really want to get the right kind of pad.
Okay.
All
right, so if you have, until they can get treated and cured. All right, well, thank you so much.
In the meantime.
Well, thank you so much for coming.
Thank
I can't
you.
wait to learn some more exercises.
It's my pleasure. Thank you. Thank you for having me.
Thank you so much for joining us on the Lisa Saunders Show. See you next week.